Hi, my name is Dr. Tina Ho. I'm a double board certified facial plastic surgeon based in Philadelphia. This is an educational webinar regarding deep plane facelift. Deep plane facelift surgery is one type of approach to facelift. Traditionally, earlier approaches to facelift involved mainly removing skin and tacking back skin, as well as entering the deeper layer, which we call the SMAS, further back here. The deep plane approach is a very comprehensive approach to facelift surgery, but also yields the most definitive, most dramatic results. So in terms of who may be the best candidate for deep plane facelift surgery, it depends on a number of factors. The average patient age may range from 40s to 60s or higher. However, the trend has been for patients who come into my practice to be as young as in their late 30s, who are seeking out more preventative or definitive measures to get the best rejuvenation results. Those patients who are typically good candidates for facelift surgery include those who feel that they've seen descent of the tissues or sagging with time, particularly in the cheek area, as well as the jawline, including signs of jowling. Often these patients also show signs of aging, laxity of the skin and the deeper tissues in the neck as well. These patients often have goals of wanting to restore definition and volume in the cheeks, as well as definition and contour in the jawline area. The approach with a deep plane facelift first starts with incisions along the hairline and the edges of the cartilages here, extending behind the ear into the hairline back here. The skin is first lifted up, and then the deeper SMAS layer is entered closer to the mid-face. With entry of the SMAS layer more medial here, we're able to then gain access to the more dependent tissues here, compared to more traditional approaches where we enter back here and are not able to achieve as much lift. I then release ligaments that tether the tissues in the face, and ultimately there's a nice passive release of the tissues. With tacking stitches, we're able to restore definition and volume in the cheeks, as well as restore a nice improvement in jawline contour here. I also think it's important to address the neck, perform a definitive neck lift at the same time as facelift to achieve the best results. Recovery following deep plane facelift varies by patient. I don't sugarcoat it with patients. I'm very real in terms of this is a big deal of a surgery. Following surgery, the patients will have a compression dressing for about 24 hours. I see the patients the next day. We take down that dressing and we'll go over their wound care as well as review their drains. They will have drains for up to a week out. The patients will experience swelling as well as bruising that will peak at about 48 hours after surgery and then start to subside. We have a lot of tools in our post-operative plan to help patients have minimal downtime and to accelerate their healing. One tool is Elixir MD, a photomodulation device that helps to reduce swelling, bruising, also lymphatic drainage to really accelerate the healing process. This device is used to provide treatments for surgical patients the day before surgery, a detox treatment, and then as soon as the day after surgery, every couple of days for that first week or so to help optimize healing. So regarding the results following deep plane facelift, the results are natural and long lasting. In my opinion, the most definitive, most permanent results compared to traditional facelift techniques. Patients will see a great degree of the results with some residual swelling at about a month following surgery. The first 3 months, there'll be some fluctuations in swelling, but then we'll get over that hurdle where there's more of a gliding phase closer to 6 months out. Final results are typically seen at 6 to 12 months following surgery. I do caution patients where surgery is permanent and the most definitive, we continue to age with time. So with deep plane facelift surgery, I'm hoping to give patients results that last 10, 15, 20 years. Thank you so much for taking the time to watch my deep plane facelift webinar. Please reach out to our team with any questions. We look forward to meeting you in consultation and helping you achieve your facial rejuvenation results.